When a patient comes into our clinic with chronic degenerative knee pain, most of them have been told by their medical doctor that they need a total knee replacement. Well, I'm here to tell you that that's not the case. You do have another option. When you take a step from a standing position, your brain sends a signal down the spinal cord and across the nerves in the leg into the popliteus muscle behind the knee. And that's what unlocks your tibia and your femur bone. If there is a lesion along the pathway, your knee stops unlocking properly and it's going to start yelling at you. So what we do in our clinic is we do a non-surgical operation that resets the communication between your brain and your knee, instantly decreasing pain and inflammation, increasing strength and stability, and helping with tissue healing.